What drew me to oncology was, it's kind of a personal thing because there's a lot of cancer in my family, and specifically I had a sister-in-law who was diagnosed with breast cancer in her early 30s. She and I were the same age. And I was with her for a good portion of her journey through the cancer experience. As I was working with her and as she went through the cancer experience and things were progressing and getting toward the end, she was having a lot of pain and a lot of other symptoms, and there wasn't a lot of people out there who could help her. She lived in a small town in Texas. There wasn't a lot of palliative care available. And so I would kind of over the telephone talk to her about her medicines, and towards the end of her life she told me, she says, "Why aren't you doing this for a profession?" She goes, "You have helped me so much, I can only imagine how you could help other people." And I took that to heart, and when I moved to Portland, the one and only job I ever got offered was a palliative care job in oncology. I always keep my sister-in-law, her name was Kim, I always keep Kim's experience in the back of my head and try to remember that this can happen to anyone. And so it helps keep me very grounded in the work that I do, and hopefully it helps keep me real when I'm working with the patients, so that whatever we talk about, whatever we do to help them, it's something that they can handle, and it's something that's going to work for them, and they feel like they've got an ally in this battle. I like to often tell patients, I want you to live your life and not live your cancer. And so I help patients to do that. And I had an experience a few weeks ago in which a patient leapt out of her chair in the infusion room as I was passing by to stop me and give me a great big hug. And she wasn't even supposed to see me that day, and she said, "Thank you so very much. My pain is under so much control now." And her family sitting there with, 2 thumbs up behind and smiling and everything. It was kind of caught me off guard because I wasn't expecting it. But to me, that made my day. That I was on cloud 9 for the rest of the day just because of that one experience. I think if nothing else, I'd love people to walk away going, palliative care is a universal kind of thing. It isn't just for something to be applied at the end of your life when you're going on to hospice. It's something that can be used way earlier than that to keep you comfortable, to keep life enjoyable, to give you meaning to your life, to get you well enough you can do the things you've wanted to do, or at least get to the things that are important to you. I love the fact that, if nothing else, at the end of the day, I'm dead tired, it's been a rough day, but at the end of the day, I go home feeling like I made a difference, even if it was just a small difference.